Okay, let's talk about the set down. Now we've actually called or nicknamed the set down the secret sauce because it really is truly that secret element that brings you from good to great when it comes to this adjustment. It moves you from being very good to into the level of mastery when you can master this idea of the secret sauce. It really is that important. I remember a number of years ago, I was on a mission trip with Dr. Kale back in the 1990s, and we had the opportunity to go to the Bolshoi Theater and actually adjust some of their players. And when we did that, I actually was adjusting people Dr. Kale was watching, and he came up to me afterwards. He says, "Hey, Rob, you're not doing a set down." And I asked him, "What's a set down?" I had no idea what a set down was. And he explained that to me, and I actually started putting that in my practice. Within 2 to 3 weeks of me coming back from that mission trip, I had 2 or 3, maybe 4 people taking eyeglasses off because their eyesight had improved. And I had another person that I'd been seeing that had diabetes, their sugar started coming down. And I started seeing some things happening with the adjustment that I really recognized that there was something that happened. So the secret sauce, or this set down, really is key. But to understand why it's so important, I would step back and say, first, we need to know about paradoxical motion. If you remember, we talked about paradoxical motion, how the head rotates, and as the head's rotating, the cervical spine is rotating, and right at the very end, the atlas continues to rotate, and the condyles actually counter-rotate or paradoxically move. Now, not only that, but the atlas goes down the hill. And then you have the curvilinear misalignment. You have all these issues, condyle up here, atlas down here, and it's in a pre-torqued position. It's in a pre-torqued position. So we don't need to go in there and do a lot of jarring. We don't need to do a lot of the traditional type of the toggle, because we're using the posterior arch as a lever, and we're literally driving that, so driving the lateral mass around that condyle. Now back to the set down. The set down is important because it's the final step that really locks you in so that you don't have looseness, if you will. You don't have, it's tightened down so that there's not a lot of movement going on there. Let me back up a little bit and say, we do our contact, that's step 2. We do our tissue pull, that's step 3. Then when we do the roll-in is actually taking is the second tissue pull, and it's further tightening down the contact. So when you do tissue pull, you're moving the skin away. When you do the roll-in, you're even moving more skin, and you're getting closer and tightening it down from your contact point to the bone, if you will. Of course, you don't touch the bone, but you're getting tight on that. Then the last step is that set down, and that's where this thenar eminence is coming down, and it's going to actually touch the top part of the thoracic spine. Is pushing down this way. You're doing that without exerting more pressure here. The reason why you're doing that is because you're tractioning the neck down to lock down that joint, the COC1 joint. And when you do that, then you can go in there, and it does not take a great deal of force because everything's locked down. If things are not locked down, then you have to use more force to get through the patient's resistance. And if it's not locked down, you're going to create jarring. And anything that creates jarring is going to make it more uncomfortable for the patient, and that's not desirable because, you know, how many people like to be hurt with getting adjusted? But also on the other side is that the more jarring you have in the adjustment, the less effective as far as getting the line to really settle down that you're going to be. So if you can get a nice set down, it's going to reduce the amount of force that you have to use, and that will ultimately lead, on average, to you getting straighter lines and them holding longer. So I hope you've enjoyed this video on Secret Sauce. Thank you.